Yes, so I will talk about some of the myths that we encounter. CBD is a hot ticket right now among medical scientists, health professionals, and the public is becoming aware. But along with that awareness is a lot of misinformation. First myth, CBD is medical, unlike THC, that's the recreational part. That's the first myth we encounter. We get a lot of queries from all over the world at Project CBD on a daily basis. Where can I get the CBD? I just want CBD, not THC. Only CBD. Well, only CBD doesn't exist in nature. If you're looking, depending on what your condition is, if you're seeking out only CBD, it might not be very effective. In fact, even for the children with catastrophic seizure disorders, which are CBD-dominant remedies have proven so miraculous, it doesn't always work. And in fact, we have examples of parents who try it. It might be a Charlotte's Web or some other strain. It's not working, they increase the dose. It's not working, they increase the dose again. Not working, they think I have to increase the dose again. It seems they're on the wrong path here. Maybe if they added a little THC into the mix, it might be better. CBD, I should say cannabis, is a dialectical plant. It has compounds in it that have opposite effects and yet also synergistic effects. Example, THC, the high causer, our beloved psychoactive compound. It has certain effects that CBD can actually neutralize, depending on how much CBD and THC is in a given strain or remedy. The CBD might actually neutralize, completely eliminate the psychoactive effects of the THC. And yet at the same time, the CBD can enhance THC's pain-killing effects, its anti-tumoral effects, and so on. So opposing yet synergistic, that's dialectical. That doesn't necessarily fit in with the typical allopathic medical model. But what else do we get? What other kind of questions we get? We often are asked, well, do you have Charlotte's Web? Can you tell us where you can get Charlotte's Web? I say, well, it's in Colorado. I know it's being grown by affiliates in California. I don't know how you can get that other than sign up with Realm of Care and go through that process. Good luck. It's proven to be very, very effective in many cases. It's tremendous. But it doesn't always work. And sometimes we get people saying, well, I want some, and I inform people when I'm asked that question, but by the way, there are several strains that are very similar in terms of the CBD-THC ratio, this CBD-dominant ratio with very little THC, typically just the opposite of what we find in most dispensaries for the medicine there. But again, there's sort of misconceptions about this. Well, it has to be exactly the same ratio. It's got to be 30 to 1 or whatever they're claiming it is. The problem is that labs that labs that analyze these strains, they're accurate but not absolutely precise. They can't be. So if you're measuring something and you get 0.2% THC, another lab, or maybe the same lab, can measure the same thing and get 0.4%. Well, you just changed the ratio from 30 to 1 to 15 to 1. So this idea of you have to have the biggest number, this is my CBD is bigger than your CBD. This is another, but we confront this a lot. I was just in Uruguay, just to shift gears slightly here, and I was meeting with doctors and human rights activists. Incidentally, in Uruguay, they consider cannabis access a human rights issue. But I was often asked by the doctors they would ask me, well, what's the best ratio for this condition, CBD and THC? And I'd first say, well, I'm not a doctor, and I can't really tell you these and give you answers to these questions. I can give you sort of generic feedback on the basis of what we're hearing at CBD from doctors and from scientists. And we can make general comments. Yes, it's clear that in the cases of Dravet syndrome and these other epileptic disorders, a CBD-dominant remedy will often be effective. Not always, but very often, it turns out. For something like anxiety, if that's your issue, more than likely a CBD dominant ratio, little THC, small doses, will be effective. That's again what we're hearing. But if you're dealing with pain or cancer, that's too narrow an option. You need a broader range of ratios, a broader range of medicines to choose from. There's a lot of work with Sativex, GW Pharmaceuticals, clinical trials actually, not just preclinical animal studies. They demonstrated clearly that for pain and spasticity, multiple sclerosis, and other neuropathic pain issues, that a more even ratio of THC and CBD is more effective. For cancers, I'd say more likely the same. And yet we're getting queries from people. I have cancer, my wife is this, and where do we get the CBD only, something without THC? And I said, well, good luck, but from what we're hearing on the basis of the information we have, that might not be the most effective approach. There's many other myths we can kind of rattle off here. Let's see, I have one more minute. Potency, how much to use, and how do you that's the other question, not just the ratio, but how much you actually take of the medicine. I've heard some people who are advocates calculating the dosages on the basis of animal studies. I'll give you just a quick example in terms of juicing cannabis. It was based on a study that showed 20 milligrams per kilogram of CBD was effective in an animal study. Pure CBD, not whole plant CBD. And yet this was used to transpose a potency for a different compound, CBD acid, which is different from CBD. The CBD in its raw form, unheated form, of the whole plant for a human. 3 different factors here at play. And as a result, we end up being told that these enormous doses are necessary because it was the 20 milligrams per kilogram. And I'm not sure if that is the case. I do know that the raw cannabinoids can be very effective medicinally. And we're getting information now how for the children with epilepsy, sometimes THCA, the raw version of THC, the unheated version, can be very effective. But again, and this is getting transposed, well, it can be just a substitute for CBD. You don't need CBD, all you need is THCA. I wouldn't go that far, particularly for many other conditions. Much less is known about these acid cannabinoids than the actual, that's what we call the neutral cannabinoids, the heated cannabinoids. I could go on, and I wish I had more time, but I think...
Give it 1 more minute.
1 more minute, okay.
Go on for 1 more minute.
1 more minute, let's see what we want to do. Well, when we launched Project CBD, we mean Fred Gardner, editor of Shaughnessy, and I 4 years ago, we had this idea that we made the assumption that once we discovered these CBD-rich strains, the first few came into our possession, that this could be very significant because we had been attending science conferences for several years in which they were discussing the preclinical, the animal studies, the preclinical work with usually, sometimes whole plant CBD, more often than not synthetic CBD. But the revelations that we were hearing at these science conferences were so astonishing in terms of the broad range of conditions that CBD could potentially be applicable for. That once we actually rediscovered that the CBD was available on the grassroots, the first question was, well, what will this mean? What will happen if this gets out here? Will it be anything like the preclinical studies? And I think, in fact, it is. It's even more amazing in some ways. When you see the children with epilepsy respond to this, I mean, how could it not? It's just astonishing. It's better than any science could ever try. But I think we also had another assumption was that we felt that CBD, and when I mean that, I mean CBD-rich cannabis. That's a phrase we coined. We didn't want to say high CBD, so we said CBD-rich. Could be the nail in the coffin for prohibition. Because what could the drug warriors say about this? I mean, it's safe. It could be non-psychoactive, at least not like THC is psychoactive. What would be the response? But what we never anticipated was that this would be used to actually limit the legalization, as we're seeing with the CBD-only bills, as they're called in several states. Now, I have a very mixed feeling about this. On the one hand, anything that can help someone who's desperately ill, and if that means a CBD-only legislation, how can you be against it? On the one hand. On the other hand, this will only address a very narrow range of needs in the patient population. So we don't go and advocate for it. We advocate for full legalization. And the other thing I didn't expect when we launched the Project CBD, this is my last point, we never expected this would become the focus of these multi-level marketing campaigns, these pyramid schemes, Canaways, the one we're hearing about now. I'm sure you've been hit with this stuff. I mean, never in my wildest thought. I think, and there's a lot one can say about that, and that's controversial. It's controversial within our community, and I wish I had more time to address the controversy, but I think in the interest I should turn it over there.
Thank you.
Thank you.